Well, I'm joined now by Sam Rose, Director of Affairs at the United Nations Relief and Works Agency. Thanks very much for being with us. Just first of all, Sam, if I can ask you about the reopening of the Rafah crossing, what more do you know about when and how this will happen?
Thanks for having me on. We know little more than what was reported by your correspondent earlier. We understand that pilots are taking place today. Preparations are underway, but it's not clear quite how this will work in the days to come. What we know for sure is that any movement of Palestinians into and out of Gaza will remain extremely limited for the foreseeable future. But look, despite that, I mean, this is a positive development. The Rafah crossing point is the single lifeline that Palestinians, 2.1 million of them inside of Gaza, have to the outside world. So people are cautious, people are very tentative and anxious about what's happening. But hopefully, what will start with the movement of just a few hundred people will expand over time. There are tens of thousands of desperately ill Palestinians that need to get out urgently for medical care. It's critical that they get out, and we hope that that will now start to happen in larger numbers than we've seen over the last 2 years.
And are you or other bodies of the UN involved in facilitating that, and where would they go for medical treatment?
I mean, the World Health Organization is a part of the United Nations that manages what we call the medevac, the medical evacuation of sick Palestinians. In the first instance, they go to Egypt, but where they end up also really depends on the countries with whom agreements have been reached for the patients to be treated. Over the past couple of years, the majority of patients that have come out have been children, most treated in the region, but some further afield. And of course, these children have to be accompanied by adults, by carers, by guardians. So it is quite a complex process. But as I say, close to 20,000 sick Palestinians who are waiting, desperately needed treatment outside.
And we've had these reports about MSF that you'll have seen, and I just wondered whether you are aware of that, whether you're in touch with colleagues from MSF being banned, and whether the UNHCR has handed over staff lists.
I mean, I can't talk to UNHCR because they don't operate in Gaza, in Palestine.
Sorry, yes.
UNRWA is responsible for Palestine refugees in these areas, as you know. And MSF are one of 37 international NGOs that have not been registered by the Israeli authorities to continue working inside of Gaza and or in the West Bank. And this will have major negative consequences on the ability of international organizations to provide healthcare inside of Gaza. Inside Gaza, MSF were providing a lot of important healthcare, primary healthcare, but also hospital support and things like that. And the reasons that's been given is because they're not handing over their staff list to the Israeli authorities. They and others have their own reasons for doing that, given the large numbers of staff of medical organizations and international organizations that have been killed over the past 2 years. 385 of my colleagues in UNRWA have been killed since the start of the war on the 7th of October 2023. And UNRWA is the one organization that has been handing over staff lists to the Israeli authorities. And we've been doing this regularly for almost 20 years now. And it's not done us much good in terms of protection of our staff or also in terms of our ability to operate as UNRWA. I'm currently not allowed to be in the Gaza Strip. My organization has not been allowed to transport food or other urgently needed supplies into the Gaza Strip as well. So I fully understand why the international NGOs are operating in the way that they do. They have to put the needs of the population first, but they also have to put the safety and their duty of care to their staff. And if that can't be guaranteed, then this is what we see. But all in all, this is going to result in a further shrinking of operational and humanitarian space for humanitarian organizations working on the ground in Gaza right now. So as we have seen so many times throughout this conflict, we're seeing really competing dynamics here. On the one hand, positive progress when it comes to the reopening of Rafah, and yet over the past 24 hours, 30 Palestinians were killed in airstrikes during a ceasefire. And at the same time, international organizations that are equipped and qualified and capable of doing work which is urgently needed are continuing to face major constraints. And this is why the Palestinian population of Gaza is waking up yet again today with massive trepidation, hope that people will be able to get out, but real fear for the future.
Sam Rose from UNRWA, thanks very much indeed for your time.
Thank you.
A judge